Due to the Delta variant, COVID-19 cases are on the rise yet again, and to add even more anxiety to parents, COVID-19 cases and hospitalizations in children are at an all-time high. So perfect timing. Today, we have Sanford Health pediatric infectious disease physician, Dr. Allison Horniak. Thank you so much for coming in today.
Thank you for having me.
I thought this is great because we kind of want to break it down. We get so caught up sometimes in masks, no masks, adults, what we can and cannot do. But right now, our focus should be on kids. And can you tell us a little bit about the Delta variant and our children? Does it affect them differently?
So the big thing that's come with Delta variant, which is now by far the dominant strain in the United States, I think it's somewhere like 98% of cases are due to Delta variant, is that it just seems to be more contagious. So last year, we were seeing that kids were less likely to transmit the COVID virus as opposed to adults, but now we're seeing it's much more contagious amongst younger children. So that's one thing that we're worried about. We're still trying to piece out if it's causing more severe disease in children. Some parts of the country are seeing higher rates of hospitalization in children, and some are seeing sort of percentage-wise equivalent to where we were last year. So that's sort of something that the data's still out on. In terms of symptoms, typically it's the similar symptoms to what adults have. Children might not communicate those classic loss of smell, loss of taste symptoms just because they aren't really aware of what that is. So that's less something to watch for in children, but more or less the common cold symptoms associated with a fever are reasons that you'd want to get your child tested. The other thing that we had seen with COVID last year is the MIS-C process, which is the multi-inflammatory syndrome. We haven't seen an uptick of that yet with this new wave. Again, we might just need more time to see that, but that'll sort of be interesting to see if that happens with Delta as well.
And are you following, I would imagine you are, 12 and up can get the vaccine. We're still testing and waiting for 12 and under until the vaccine's available to all of our children. What are the best ways for them to protect themselves?
So it's the same things we're going to be relying on last year. And I have a 5-year-old daughter at home. She's starting kindergarten next week with Fargo Public Schools. So this is something I'm keenly keeping an eye on and aware of. But it's the same things: the social distancing, hand hygiene, good, sanitizing of surfaces, staying home when you're sick, those sorts of things, and of course masking, which I know we're going to talk about more.
Okay, yeah. So I want to know if you think masking in schools is a good thing.
I do, and I know this is an incredibly contentious topic right now. I know we had the Fargo School Board meeting last week. I think West Fargo and Moorhead are next week, so this is certainly a hot button topic. And I want people to remember that it's not just masking. When we talk about COVID mitigation strategies in schools, it is mitigation, it's not risk elimination, it's mitigation. But we're talking about masking, we're talking about testing, we're talking about contact tracing, cleaning, ventilation. There's so many other aspects to it, and we tend to get caught up on masking. I do recommend wearing masks in schools. That is in line with what the CDC and the American Academy of Pediatrics are recommending, as well as the North Dakota Department of Health. So certainly in line with that as part of that total layering of mitigation strategies. It works and it's important. I look at my kids and I don't want her to get quarantined for 14 days and being a working mom, working full time, I don't want to have to be home with her. And I see wearing masks in schools as a way that we can prevent those school closures and those mass quarantines that we would potentially see if we weren't masking.
So do you have concern as being a pro face mask person? I don't know if you want to be labeled like that, but when you're talking about it's more contagious, for kids, could they be asymptomatic as well and then spreading it to all of their classmates?
Absolutely, absolutely. We are continuing to see pre-symptomatic and asymptomatic spread.
Okay, so when you talk about more contagious, because this is interesting, you did touch on it, but some people think that the Delta variant is just really targeting our children. But you're not saying targeting our children, just way more contagious.
Yeah, absolutely. Adults as well as children, yeah. Certainly our adults and our kids over the age of 12 are getting vaccinated, and so we're seeing different rates amongst vaccinated individuals as well. But it's not that it is just targeting our children, by no means.
And how about within a family? When, maybe parents already had it, they've been vaccinated, and then the kids get it. Is there any concern? How does that work inside a household?
So the risk is there. Always with COVID, we're worried about those close personal settings. So that's why schools, workplaces where you're really working closely with individuals for extended periods of time, those are our high-risk settings, as opposed to the grocery store, other things where you're kind of passing by each other. So certainly in the household, that's a high-risk setting. We are seeing vaccination is protecting older individuals. We are seeing now that there is some waning immunity. I think the most recent data I saw on the Pfizer vaccine was that it's down to 47% protection or somewhere about that. So certainly there is still a risk to vaccinated individuals in the home.
Well, thank you so much for visiting with us today. Kind of going back to the science, behind COVID and the Delta variant. I appreciate your time. Stay with us. Coming up next, we're helping your college student ease into that new schedule.